Well, it is Wednesday in the 8:30 half hour. That means we are joined by Dr. Syed Hussain from Trinity Health in New England to talk about all the topics that are trending in the world of health and medicine. Good to see you again, sir.
Likewise, Tim.
Still fist bumping because we're in the middle of flu season, but boy, we have a good update on that front, don't we?
We do. So welcome news for Connecticut residents, Tim. We are seeing a plateau in terms of ED visits for influenza, a downward trend for COVID-19 and RSV. Yep. And a welcome decline week over week for hospitalizations for these three respiratory viruses that are tracked statewide. So that's great news. Wastewater surveillance for COVID-19 also showing several weeks of decline, which then translates to how many people show up in the ED, how many people actually get hospitalized. We're still in the colder season, though. I just don't want people to not take any precautions, especially if you have underlying medical conditions, if you live with someone who's sick or at higher risk for developing complications from flu or COVID-19. Please continue taking those precautions, especially when you're out in public, indoor spaces, and wear a mask, hand hygiene. But it's welcome news nonetheless that we're seeing a downward trend.
Yes, because lower doesn't mean low. We're not low yet, but there was a big decline week over week. I know in some flu seasons past, sometimes you get a little secondary bump towards the end of it.
And we got that this time around.
We did.
When we did have, if you look at the data from December into January, when we suddenly started seeing a very high number of respiratory illness, we did see a little bit of a bump. But to your point, we're not out of the woods yet. It's important to take those precautions till the season starts warming up even more.
Yes. Okay, on to COVID-19. You had mentioned that. I'm just going to guess that for a lot of people, I think they think mistakenly that it's caused by the coronavirus as opposed to a coronavirus, of which there are many. And now researchers have found a new type of coronavirus in bats. What do we need to know? Yeah,
I don't want the folks, viewers, public to get alarmed by this. There are hundreds of coronaviruses. It's a very large family. A small segment of them may infect humans. In fact, the common cold viruses that go around every season, Tim, are linked to the coronavirus family. So this is a newer virus. It's similar to SARS-CoV-2. That's the virus that caused the COVID-19 pandemic in 2020. And this is called HKU5-CoV-2.
Okay.
It has a similar mechanism wherein they did a lab test in Wuhan, actually. And they saw that there's a similar mechanism that the previous virus used to enter human cells. But on the good news front, and current antivirals that we have work against this virus too.
Yeah, and it looked like it wasn't quite as able to stick on those receptors.
It's not easy to get into human cells.
Yes.
At this point. Nothing to get alarmed about. The CDC will keep an eye on this particular strain, but it does not pose a threat to the public at the current time.
Yes, and I believe the research that is done didn't do anything to sort of even try to gauge how disease-causing it could be. It might not even cause disease at all.
That's right.
Okay, so that is good. One last little topic here. A new study found that just 5 minutes of light exercise a day could lower your risk of dementia. What's behind that?
Yeah, so this adds to a growing body of evidence that shows if you lower risk factors, control your blood sugars, high blood pressure, lifestyle modification, exercise. This is an observational study, so there's an association, we can say, not causation. Right. It's not a large clinical trial, Tim. Just for viewers to understand the basics behind the concept of this study.
Yes.
But it shows activity equals lower risk of dementia. More activity, moderate to high physical activity over a period of a week, anywhere from 35 minutes to 60 minutes, can lower the risk by 60%.
Wow.
In individuals. And this is all linked to higher blood flow, removal of metabolic waste from the brain, decreased reason for plaque formation because there's better flow, all things to, that probably lower the risk of developing dementia.
So basically, even though this study only found a correlation and nothing causative, there's at least an idea of what the mechanism could be that would cause it.
That's right. Exactly.
That's the idea. I know. It's always, you got to draw a very fine line when you're looking at medical studies like that. It's important to do. But good news nonetheless. We'll
For
take
sure.
it.
Absolutely.
All right, doctor, thank you.
Thank you.
Dr. Syed Hussain from Trinity Health of New England. All right.